Good evening, everyone. John today. God is good and God is good all the time. My name is Aaron J. And also unsolved missing person. Um, the first I'm gonna talk to you about HHS traveling expenses across the state, and that's something the president came up with, and I think that was a good idea. So he will order HHS to consider using Medicaid to support women seeking abortion across the state. Cause you remember the women had started traveling to try to get this abortion done because some of the states had restricted and banned abortion in certain states. So they started traveling. So this would be a good idea for to pay for their traveling expenses. So HHS is a Health Human Services. Consider using Medicaid to pay for expenses for those who cross the state line to seek abortion. So I think that's good. So they always donating and giving women's money for their traveling expenses. So this would be a good idea to help them out. So the president also stated that the order will direct HHS to consider action to advance access to the healthcare services, including through Medicaid for patients who travel out of state. So the Medicaid will not pay for the abortion. They pay for traveling expenses. They're still working on the costs of the Medicaid, that they're trying to put together. But first, they first brought this attention to HHS, because they deal with travelers, children that travelers and stuff like that, So this would be a good idea that they will help out with their traveling expenses. Now, the action will require states where abortion is legal to apply for Section 1115. You know, so the Medicaid waive to provide services for women crossing the state line for abortion. So that'd be a good idea. Also, you know, so Section 1115 waive is to allow states to waive certain federal stationary Medicaid programs that requirement of obtain federal matching funds for costs or investments that would not otherwise be allowed under Medicaid program. So he came up with this idea in this Section 115 waiver will deal with certain things, investment of certain things that otherwise allow them to have this to come through. So that'll be a good idea there. So waiver would have covered certain costs, low income. So Section 1115, the waiver, it will help cover certain costs for low income women who receive Medicaid. It will not pay for the abortion, but it'll help out with your expenses. Whoever traveling, because the abortion is still not legal all over the state. They're still working on it. And I talk about this many times. I think a couple of weeks ago I had also made it across the nation, to be legal to have an abortion because I saw how the women was traveling all over the state. So I see that they're still trying to work on it. So I spoke on abortion many times. The first time, so this is the first time these women would start, when they first start traveling. That's when I had spoke on. I spoke on it many times before that, but I also spoke on it with the travel, to have the procedure done, so, and I had spoke for across the nation, for all, to request for all the abortion to be legal all across the nation. So the latest order will also instruct HHS to consider the assistance and other action to make sure healthcare provides comply with non-discrimination. So they're working out all kind of details. They're trying to make sure it don't have no discrimination, laws. Because it's for all. It's for all. So Congress will reject amendment that will have proven the way for abortion restriction. So they coming out they're coming up with something for these women and trying to make sure everything is lined up in there. So American agree that women should have access to abortion and should have the right to make their own health care decision, which is right. So everyone should listen to American people, women, and restore the protection and their rights to choose. To have the right to choose, what they want to do with their body. So and they have the right. So I don't understand, they have the right to choose what they want to do with their body. You know, so our president also, it's a good idea that he came up with something to help women with traveling, trying to get these services done. Considering HHS to use Medicaid to pay for the expenses across the state. You know, um, for patients who travel, for patients who travel out of state trying to get this done because it's still not legal for abortion in certain states. That's the reason why the women's had started traveling. So and now this is not paying for the abortion, only for the travel expenses through HAS. So section 115, we talked about that. They're waiving it to allow the states, to certain federal stationary medical program. So they're waiving it for the program for the Medicaid to have these things done. Matching the funds for costs. Investment that would not otherwise be allowed under the Medicaid program. Otherwise this wouldn't have been allowed for the Medicaid. So you use this section right here to make it possible to be used. So that's that on the traveling expenses for the abortion. So now we're gonna talk about it's going back to school. So it's gonna be kind of quiet around here. So I have some guidelines for kids and teachers that going back to school. Safe tips. You know, One, this is for all the teachers. Make sure you all been tested for COVID. Taking the vaccine test for COVID before you go to school, before school start. Two, teachers and kids, make sure y'all face masks. Make sure your face masks. Three, make sure sanitize in all the classrooms. You know, and four, make sure all the kids' desks are 6 feet apart. Also in the lunchroom. You know, um, five, make sure all wash hands on a regular basis. 'Cause you know how the kids is. The kids be touching stuff, next thing you know, their hands is all in their face. You know, so every hour, every 2 hours, make sure they constantly wash their hands before they put their hands in their face. So we just talk about um, the president came up with a good idea for Medicaid, but it's only for traveling expenses because they had the women's had started traveling to get the services done for abortion. Because it's still not legal, and I did spoke on it like the last month sometime for abortion to be legal all across the nation. So I see they still working on it. So the president also he also stated with section 1115. That's waived, the Medicaid waived to provide these kind of services to take place. And so he say it's gonna be directly to HHS because they already deal with children that travel alone. They already pay for their expenses. So this would be a good idea. For them to help out with this case here. So advance access to health care services, including Medicaid for patients who travel out of state. So that's be a good idea to help. And we also talk about the American women, all the American women that do have the right to choose what they want to do with their body. You know, they have the right to choose. So now this Medicaid that the president is coming out with It do not cover Medicaid. I mean, say it do not pay for the abortion fee. It's only pay for the traveling fees to have this procedure done. You know, because for right now we're trying to make it legal for all across the nation for abortion to be legal. And in the time being, most women are traveling, and they're trying to come up with ways for expenses for these ladies that are traveling. You know, so I think that's a good idea for the expenses. You know, that's still a help. You know, and they're still working on a cost of what else gonna be used in that Medicaid that you will be applying for. You know, so um, and we also talk about the children that's going back to school. You know, but it still have to be safe because you have to remember the COVID are still active. You know, it haven't gone away. We gonna have this for a while. You know, and a lot of people are still getting a COVID. You know, so the children have to go to school and learn, but we also want them to be safe. You know, and the teachers have to be safe for the kids to be safe. You know, so all the teachers, you know, make sure y'all take the COVID vaccine, you know, before y'all go back to school. And make sure y'all all have face masks. You know, the kids, they have the little small, make sure the kids is kind of thin where they can breathe. You know, depending on if they're not in pre-K or kindergarten. I guess they cannot, you know, wear the mask. But then the upper grades, they have to have a mask on. You know, so make sure we have sanitizer in all the classroom or, you know, in the cafeteria. You know, and make sure the kids' desks are 6 feet apart. You know, and make sure they're apart in the lunchroom. You know, and make sure they wash their hands on a regular basis because the kids constantly put their hands all in their face. You know, so make sure they constantly washing their hands and you know, constantly wash their hands because they always touching, kids always touching stuff. You know, so that's all the show news I have for you on today, and I'll see y'all on the next video. Have a blessed day.